Eastern Maine Medical Center has cared for generations of Mainers since 1892. With 411 beds and several outpatient locations in Greater Bangor, we provide highly specialized care that's not available elsewhere in the northern two-thirds of Maine. We know that being in a hospital may be unfamiliar to you, and you may have questions. Allow us to show you how we will support you while you're in our care. Northern Light Eastern Maine Medical Center is located at 489 State Street in Bangor, on the banks of the Penobscot River. Our main entrance is on Hancock Street. If you're coming from I-95 and Hogan Road, pass the first stoplight in front of the hospital and turn left at the next stoplight onto Hancock Street. The hospital entrance will be on your left. Continue to the main entrance for valet parking, or park in the parking lot that's on your right as you enter the hospital driveway. You may also park in the parking garage. The entrance to the garage will be on your left as you drive into the hospital. Valet parking is available at the main entrance from 5 a.m. to 5 p.m. Monday through Friday. There's no charge for valet parking. After you park, enter through the main entrance and check in at the information desk. Our information desk attendant will be happy to help you find your way and assist you with anything else you might need. The hospital has several buildings and might seem confusing at first. We're here to help you every step of the way. If you have questions or need directions, ask anyone who has a hospital badge. For your health and safety, tobacco use, vaping, and smoking of any kind are not permitted inside or outside the facility. Our tobacco and smoke-free policy applies to patients, visitors, staff, medical staff, and volunteers. Please ask your provider about tobacco and smoking cessation resources at any time. A gift shop, retail pharmacy, and credit union are located on the first floor of the hospital for your convenience. Ask anyone on your care team, the information desk attendant, or any other employee for directions. The hospital's non-denominational chapel is open 24 hours a day for quiet meditation and personal prayer. Regularly scheduled Catholic, Muslim, and Protestant services are offered for patients and families. Ask your caregiver for a complete schedule. An entire team of professionals will be involved with your care. Your care team might include doctors, nurses, therapists, and technicians. You'll probably also be served by food and nutrition services staff, housekeeping staff, patient transporters, pharmacists, and others. Your care will be directed by a physician. You may be seen by a hospitalist, a doctor who is an expert at providing care to patients in the hospital. Your doctor will assess your condition, coordinate your care, and keep your family, friend, or caregiver who is supporting you up to date with your progress. If you have a Northern Light Health primary care provider, your provider will be able to access all the details of your health care through your electronic health record. Eastern Maine Medical Center has private and semi-private rooms. The same quality care is provided in each room type. Should there be anything we can do to make your stay more comfortable, please let a member of your care team know. We want to keep you well informed about your care during your stay with us. Your room has a communication board on the wall opposite your bed. The communication board includes the names of your caregivers, treatment goals, and other information about your care. Your nurse will regularly check on your bathroom needs and pain level. If there's anything we can do to make your stay more comfortable, please ask your nurse or any staff member. Your nurse will show you how to use the nurse call system. If there's anything you need and a member of your care team is not in the room, please press the button. This is also the best way to get help quickly if you feel like your condition is getting worse or there's an emergency. Friends and family can reach you on the telephone in your room by dialing 207-973-5 plus your room number. To maintain a quiet, restful environment for all our patients, calls are not put through after 10 p.m. After hours, emergency calls can be placed through the main hospital number at 207-973-7000. A guest Wi-Fi connection is available at no cost in all patient rooms. You will not be required to enter a password to use this system. For the privacy of our patients, visitors, and staff, please do not take photos or video anywhere inside or outside the facility. Please ask your nurse, a patient experience representative, or supervisor on duty if you have questions or concerns. The Maine Cafe offers a wide selection of healthy, nourishing breakfast, lunch, and dinner items for every taste. Patient meals are available between 7 a.m. and 7 p.m. every day. Your meal selection will be delivered directly to your room by a member of our food and nutrition team. When welcoming you to your room, a member of your care team will explain how to order your meals and answer any questions you may have. If you have a special or restricted diet, please work with our food and nutrition team to help you choose your meal. Visitors may order a guest meal for a small charge, or visit the Maine Cafe on the second floor of the hospital for additional options. Our entire care team is committed to maintaining a clean and safe environment for your care. You can help by keeping personal items off the floor and away from equipment and treatment areas. Our housekeeping team takes pride in keeping your room clean. If at any time the cleanliness of your room does not meet your expectations, please let a member of your care team know so we can address your concerns. Your safety is our #1 priority while you're in the hospital. Every member of your care team is focused on reducing risks that could affect your care. Each hour, your nurse will check on you to make sure you're safe, secure, and comfortable. Your caregivers will make sure you're as comfortable as possible and will reposition you when necessary to help you to the bathroom. They'll also ask you about your pain level and may provide you with additional medication or help you with managing your pain in other ways. Please take this opportunity to ask any questions you may have and let us know if you need anything such as water or an extra pillow. A nursing leader will also visit with you during your stay to answer any questions you may have. To provide you with safe and effective treatment, it's important for your nurses to be up to date with your care. During shift changes, nurses will meet in your room to share information about your care. We encourage you and your family to actively participate by sharing concerns and asking questions. There are many things you can do to reduce the chance of a fall. If you need to get out of bed, please use your call button to request help. Do not attempt to get out of bed on your own, unless you've been instructed by your care team that this is safe to do. Help us keep your bed in a low position and keep 3 sides of the rails in the up position. Even though you may be very independent at home, when you're not feeling well and in an unfamiliar place, you may be at risk for falling. For this reason, we ask that family members do not assist you in getting up or out of bed unless our staff have discussed this with you and your family. For your safety and the safety of our staff, please keep your personal belongings within your reach and use the provided storage in your room to help keep the floor free from obstructions. We may also use special alarms or reminders to keep you safe from falling, including asking you to wear red slippers and a yellow wristband, and placing a sign on your room so our staff will know that you are at risk for falls. Hand hygiene is one of the most important ways to prevent the spread of infection. Your care team washes their hands and uses hand sanitizer to keep you safe, and we ask patients and visitors to also clean their hands. For your safety, you are welcome to ask your caregivers to wash their hands at any time. Sometimes a patient's condition may require them to be on precautions. This means that access to the patient's room may be restricted, or that caregivers and visitors may need to wear special clothing, masks, gloves, and eye protection, and wash their hands for a longer period of time. This may be done because a patient is at risk of either infecting or being infected by others. If you're on precautions, your nurse will explain to the specific precautions that need to be taken and what that means for you. Visits from family and friends are an important part of your recovery process. Visiting hours on most hospital units are 5 a.m. to 8 p.m. daily, although some areas of the hospital have different policies for visitors, depending on patient needs. During your stay, you can invite one support person to be with you around the clock. Visitation policies are in place to ensure a quiet, restful environment that supports healing for all our patients. A child under the age of 18 may visit if accompanied by an adult. On critical care units, children under the age of 12 are not permitted to visit except in extenuating circumstances when determined by a nurse leader. For the health and safety of our patients, visitation policies may change from time to time. Please contact the medical center at 973-7000 or inquire at the information desk, nurses station, or with a member of your care team at any time for our most up-to-date visitation policy. Please notify your nurse if you would like to limit the number of visitors in your room. You may also request restricted status, which means that we will not confirm that you're in the hospital or accept mail, flowers, or phone calls on your behalf. Flowers can provide much-needed cheer to patients in the hospital. Flowers are welcome on all units except the intensive care unit, cardiac care unit, pediatric intensive care unit, and neonatal intensive care unit. Some patients may not be able to receive flowers due to their medical condition. Visitors are encouraged to check with the nursing staff before bringing flowers or having them delivered. Several local hotels offer discounts to friends and family members who are in the Bangor area to support patients staying at Eastern Maine Medical Center. Encourage your loved ones to ask hotel staff if a discount is available. When your physician determines you're ready to go home, many things will happen behind the scenes to prepare you for leaving the hospital. The discharge process may take several hours. During this time, many hospital departments are working together to prepare you to leave the hospital safely. You may have lab work, x-rays, or other care during this time. We will also help arrange home care services, follow-up care, medical equipment, and transportation if you need them. You, your family member, friend, or caregiver, and your nurse will go over your discharge instructions, which explain what to do when you get home. If there's anything you don't understand, please ask. We want to make sure you have a clear and complete understanding of what you need to do after you leave the hospital. Before you leave, please check the closet and drawers for personal belongings. If you've placed valuable items in the medical center safe at registration, don't forget to retrieve them before you leave. As good as you may expect to feel when you leave, you should plan on having a family member, caregiver, or friend waiting to bring you home, or arrange for public transportation or a taxi. When it's time to leave the hospital, we'll bring you to the hospital's main entrance. The person you've arranged to bring you home can drive right up to the entrance. When you get home, please check in with your primary care provider or the physician who referred you to us. Within a few days after going home from the hospital, a member of your care team will call you to answer any questions you may have and ask if there are ways for us to improve the care we provide. We're always happy to help, even after you leave the hospital. Our goal is to exceed your expectations during your entire visit and make healthcare work for you. Your feedback will help us provide the best possible care to all our patients, including you and your family. Several days after your visit, you may receive a survey in the mail from our partner Pressgate with questions about your experience. This survey is confidential. Thank you in advance for taking a few minutes to answer the questions and return the survey in the postage-paid, self-addressed stamped envelope. We appreciate your feedback. Once again, welcome to Northern Light Eastern Maine Medical Center, and thank you for trusting us with your care. It's our privilege to serve you. Best wishes for a full recovery and a return to good health.